As a physio and fitness coach, I'm sure you've been asked by patients how much rest should they take? How much rest between sets? Should I do these exercises every day? And can I speed up my recovery? There's no set answer to these questions, and I usually begin to answer them by stating two key principles. Firstly, people have an individual response to exercise, and this may vary for individuals depending on their current environment and health status. Secondly, recovery has a psychological component and is not just a physical process. Let's consider which factors might influence recovery and why they should not be ignored. The amount of recovery needed is related to the exercise intensity. Higher intensities require more recovery. Higher intensity for one person may be low intensity for another person, so it's very specific to the individual. Recovery is a process that takes time. You can support it, but not speed it up. Protein shakes and sports massage support recovery, but unfortunately don't speed it up. Time is always needed. Time is like a prescription for recovery from training or injury. And some people forget to take their time. Again, recovery has a psychological component. The concentration, effort and sacrifice required in training requires adequate psychological recovery time. Furthermore, research indicates that forced training is more psychologically stressful. Whether being forced by themselves or by a coach, they will require more recovery. Recovery is also significantly affected by lifestyle factors, which may seem obvious, but it's not always clear to our patients. As an example, if a rest day is unduly stressful due to a car breakdown or a confrontation at work, then this realistically may not count as a normal rest day. Research even indicates that a bad sports performance debrief can cause recovery delay. From an injury perspective, it's well known that ongoing stress significantly hinders recovery. Okay, so I haven't yet mentioned sleep, which unsurprisingly has very strong links to the recovery process. One common problem I see with patients attempting to train like professional athletes is the fact that they train like professionals but recover like amateurs. Sleeping for 6 hours followed by an 8-hour shift topped off with childcare and chores is not, unfortunately, a professional's recovery day. It's a common problem that people try to cram in work and training at the expense of sleep or even just downtime. When it comes to treating chronic pain or persistent pain, some patients experience symptom flare-ups following exercise due to dysfunctional exercise analgesia. Essentially, they don't get pain relief from our prescribed exercise programs and may even get worse because of them. One way of managing this is to allow for more recovery between sets and between exercise and active parts of the day. This needs to be prescribed and monitored on an individual basis without instilling the idea that exercise is harmful. I'm going to talk about this more in another episode as it challenges our typical theories of exercise prescription. So in conclusion, exercise response is an individual experience. It varies between individuals and may vary for individuals depending on current environment and health status. And we also noted that recovery has a psychological component and is not just a physical process. So treat each patient as an individual and monitor their response to get the best results. We have lots more videos on our YouTube channel and more on the way. Please subscribe, hit the bell and like if you found this video helpful.